everyone. I'm Amanda Jandro, formerly Amanda Stevens, an account manager here at Connie. I am going to provide a brief introduction to Connie, Connecticut's State Health Information Exchange. Connie is Connecticut's Health Information Exchange, set up by a state statute to be the designated Health Information Exchange, or HIE, for the state of Connecticut. For those who don't know, an HIE is an organization that enables the secure and efficient exchange of health information among its participants. These participants include hospitals, health plans, provider organizations, labs, pharmacies, and even some state agencies. Connie was set up to be an independent, not-for-profit, neutral, and trusted organization. While the Office of Health Strategy has some administrative oversight over Connie, we are independent and have an independent board of directors. As a neutral organization, we're not set up to benefit any one part of the health ecosystem over another. So we're not here to benefit hospital systems over independent providers or health plans over patients. We consider ourselves and take very seriously our role as a neutral organization. Trusted meaning that everyone gets to have a say and a voice in Connie. We are an organization whose board meetings are public. We also invite representatives from participating organizations onto our various committees, and we utilize the feedback to guide our governance and operations activities. We were set up to be a network of networks model in that we know that Connecticut was a little bit late to the game in setting up a statewide HIE. And in that time, there were other networks that sprung up to enable the exchange of data. Our goal was not to disband those networks or even recreate them. Our goal was to connect to those networks and enable the further exchange of data. I'd like to now share a brief true story with you that illustrates the need for an HIE from the patient's perspective. This is Brenda and her mom, Carol. Carol is independent and lives alone, with Brenda being her main support system. A few years ago, Carol got sick with what her PCP and urgent care said was pneumonia. She was prescribed a number of medications and advised to stay home and rest, but really wasn't getting any better. A few days after being diagnosed, Brenda went to check on Carol. What she found was every adult child's worst nightmare. Carol was lying on her couch, weak and clearly deteriorating. Brenda noticed Carol's ankles were swollen and frantically drove her to the nearest ED. At the ED, the nightmare only got worse when the ED staff asked Brenda for a list of her mom's medications and past medical history. Brenda assumed the staff would be able to access through their EMR, given that Carol's PCP office was on the same campus as the hospital. Unfortunately, though, they did not share the same EMR. The hospital staff could only rely on Brenda's relaying of her mother's medical history and the medication list. In the end, Carol was diagnosed with a busted mitral valve and needed open heart surgery. She has since recovered, and the incident made a huge impression on Brenda. Stories like this are why an HIE, or Health Information Exchange, are really here for. Connie was set up to enable the better sharing of clinical information across all healthcare settings. We know today that there are various ways of how sharing data happens. Sometimes it happens by fax or physically carrying records back and forth from a hospital to a primary care group, or if you are a member of an electronic network, you may be able to share between members of that network, but not necessarily get data from another network. So the idea here is to enable the sharing of data across all healthcare settings, which would support care coordination and help reduce preventable costs associated with readmissions, reduce duplicative testing, and errors. Although Connie is primarily set up to support medical and behavioral healthcare providers, our design enables us to support unique projects like the HCBS value-based program through DSS. That includes both home health and non-healthcare services in adherence with federal and state patient privacy rules. Thank you, and please reach out if you have any questions.